You just tore your ACL, or maybe you already had surgery and now you're wondering, how long does ACL recovery actually take? And what should you expect along the way? Hi, my name is Dr. Ashish Gupta. I'm a board-certified orthopedic surgeon in Virginia. Understanding the ACL recovery timeline week by week can help you stay on track, avoid setbacks, and know when something is not progressing the way it should. So I am going to walk you through what you should expect after an ACL tear. First, the big picture. ACL reconstruction recovery typically takes 9 to 12 months. Your knee needs time to heal properly, rebuild strength, and regain the kind of stability you need to get back to your normal life or back to your sport. The process is broken into phases, and each phase has specific goals you need to hit before moving on. Let's start with the first 6 weeks, which is the early phase of recovery. The first 6 weeks after ACL reconstruction is all about managing pain, reducing swelling, and getting your knee moving again. Right after surgery, you'll use ice, compression, and elevation, or RICE protocol to keep the swelling down. You'll start physical therapy. Within the first week, the focus here is on restoring range of motion, especially getting your knee fully straight. That full extension is critical. You'll also begin at gentle exercises to wake up your quadriceps, the big muscle in the front of your thigh, because it tends to shut down quickly after surgery. Most patients are weight bearing with crutches right away as tolerated. By the end of this phase, the goal is to bend your knee to about 115 to 120 degrees, have minimal swelling, and walk with a normal gait pattern. Now, week 7 through 9 is where things start to shift. You'll begin balance training, neuromuscular re-education, and light aerobic exercise like a stationary bike. The focus is on building coordination and control in the knee, not just raw strength. By the end of this phase, you'll have full symmetric range of motion, and your quadricep strength should be at least 70% compared to your other leg. Weeks 10 through 16 for most patients is a big turning point. If your quad strength reaches about 80% of the other side, you may be cleared to start a light jogging program. You'll also begin working on landing mechanics, how you absorb force when you come down from a step or a jump. This matters a lot for preventing re-injury down the road. Strength training gets more intensive here, and you'll start transitioning to more gym-based exercises. Months 4 through 6 is usually when patients get into more dynamic movements, including jumping, sprinting, decelerating, cutting side to side. These are the kinds of movements that stress the ACL, so they're introduced carefully and progressively. Your quad strength and hop test performance should be at least 85% compared to the other leg before you push into this territory. The most important thing to remember about the ACL recovery timeline is that it is not just about time on the calendar, but rather it is criteria-based. That means your progression depends on hitting specific strength and functional milestones, not just waiting a certain number of weeks. 2 people who had surgery on the same day can be in very different places at month 4, and that's completely normal. Months 6 through 12 is usually the return to sport phase. This is where sport-specific drills and conditioning ramp up. You're training the movements your body needs for your particular activity, whether that's soccer, basketball, skiing, or something else. Clearance to return to full competition typically requires quad strength and hop testing at 90% or greater compared to the other leg. No pain or swelling, and, this is important, psychological readiness. Research shows that mental confidence plays a real role in successful return to sport and reducing the re-injury risk. One thing I always tell my patients, don't rush your recovery. Studies show that returning to sports before 9 months significantly increase the risk of re-tearing the graft, and only about 40 to 55% of patients return to their pre-injury level of activity. That's not meant to discourage you, it's meant to emphasize that patience and consistency with your rehab program are the most important factors in a successful outcome. Every recovery is different. Your timeline depends on your specific surgery, your graft type, and any additional injuries like meniscus repairs, and how consistently you follow your rehab program. Always work closely with your surgeon and physical therapist to make sure you're progressing safely. If you found this helpful, consider subscribing for more evidence-based content by doctors.